feel like feet are some of those body parts that you don't really know what you have until it's taken away from you.
That's exactly right. So people don't realize how important their feet are, unfortunately, until they have a problem with them. So
Yeah. In medicine, like hand call is very infamous for people doing crazy stuff with their hands. Would you say that that's similar to for feet as well?
I think it has some similarities. I think the hands, just like the feet, are as important, if not more, because you do so much with your hands. I think feet, again, just being able to ambulate and walk and do your activities are so key that I think when you do have problems that happen in the feet and you have to take care of course, patients feel a lot better. So I think it's very similar.
Yeah. What are some of the most common procedures and pathologies that you see in your day-to-day clinic?
I do a lot of ingrown nails. Unfortunately, patients get nails that are digging into their skin and cause infections and those types of things. So I do a lot of ingrown nail procedures. I do a lot of surgery. So I do a lot of bunions and hammer toe procedures. I do a lot of sports medicine. So I do a lot of orthotics. So I make a lot of custom orthotics for patients, pro athletes, for athletes in general, gait management, training. Another common thing is plantar fasciitis. Patients come in with heel pain that we take care of. So we treat that as well.
Yeah. And how does the conversation go of if someone needs orthotics or if they don't need orthotics versus like depending on the condition of their feet?
So I think it all depends on their pathologies. It depends on their pain. It depends on where they're having their pain. A lot of it depends on their gait, how they step. I have a brand new technology, which is called Go 4D Orthotic with a 3D scan. So it takes a 3D scan of the foot. It watches the way you walk. It watches as your biomechanics and makes an orthotic based on information. So patients who come in with ambulatory issues, or they might have heel pain or whatever it might be, we can make them a custom orthotic that is really precisely made for their foot that helps with what's going on.
Yeah. You talked about gait management. How is that? Is you retraining someone on how to walk or they had like an injury?
So, right, patients have injuries, patients have problems that changes their gait subconsciously. Some people just walk differently, you don't even realize it. So there are things that we do to retrain yourself how to walk back to normal. You know, a lot of times it comes back to orthotics and things that we put into the shoes to really manage the way that you do your walking.
Yeah. Is there like a rehab component in what you do? Just if someone had a really bad injury to their foot and they don't necessarily need like an orthotic, but they need to relearn how to use their foot in like a natural way.
Absolutely. I mean, we work very closely with physiotherapists. So a lot of times if we do procedures or we do things that patients go through and then they need to rehab and regain their strength in those areas, we work with the physiotherapist for the patients to get their strength back and able to do those things actively.
Yeah. And let's go back to your training for a second. I know in some specialties, like being a physician assistant, for example, residency is not required. Is it required for podiatrists?
It is now. It didn't used to be. You used to be able to do, you just couldn't do surgery. So if you want to be a surgical podiatrist, it is mandatory. But I think now it's mandatory all throughout. So any podiatrist that comes out, it's mandatory to have the residency done.
Yeah. And what was your residency like?
Residency was great. Our residency, we worked at a lot of county hospitals, which was great. So San Francisco General, Highland Hospital in Oakland. So I saw everything from gunshot wounds to the foot to wounds, diabetics, all different types of fractures, trauma, all different types of things.
Do you get a lot of diabetic patients in your practice who have like gout and stuff like that?
I do. So diabetes really, for the most part, affects two body parts for people. It's their feet and their eyes. So I have a lot of diabetics that come in that I treat. We do foot, checks, full foot checks, make sure things are okay. Diabetics are more prone to infections and foot infections, so we make sure that everyone's doing okay.